Hi, I'm Kristen Pettit from the University of Michigan.
Dr. Pettit, what are MPNs or myeloproliferative neoplasms?
Yeah, myeloproliferative neoplasms are a relatively rare group of bone marrow disorders. It's a relatively wide spectrum of bone marrow disorders as well. The most common MPN disorders that we think about are essential thrombocytosis or ET, polycythemia vera or PV, or myelofibrosis or MF. Um, all of those disorders are characterized by overactive bone marrow to start out with. So all of these disorders have generally mutations in a pathway inside of cells called the JAK-STAT pathway, which is kind of like the bone marrow thermostat. So in all of these bone marrow disorders called MPNs, the bone marrow thermostat basically gets stuck in the on position by mutations in these cells. That causes the bone marrow to make too many cells, whether it's platelets in people with ET, red blood cells in people with PV, or eventually all of the cells and some scar tissue in patients with myelofibrosis.
And what is MDS-MPN overlap?
MDS-MPN overlap syndromes are even more rare groups of bone marrow disorders that have features of both myelodysplastic syndrome and a myeloproliferative neoplasm. So in MDS, we tend to see abnormal appearance of cells in the bone marrow, and we tend to see lower blood cell counts. In MPNs, we tend to see more normal appearance of blood cells in the blood and the bone marrow. We see more overactive bone marrow. So in some patients, we can see a little bit of both, some dysplastic or abnormal appearance of blood cells, along with this overactive bone marrow production of cells. And when we see that, we call these MDS-MPN overlap syndromes. And there are a few different disorders that fit into that category of MDS-MPN overlap syndromes, but there's really a wide range of how the diseases can behave, how they can look, how they can make someone feel.
And what are the, the treatment options available for patients with MDS-MPN overlap?
Yeah, the treatment options are varied, and it really has to be personalized to an individual patient. Some patients with MDS-MPN overlap syndromes, the main issues are low blood counts. So more like an MDS kind of disease behavior. And in that situation, we usually approach the disease a little bit more like MDS. And we have some different options that we can use, some similar to MDS, things like lower intensity chemotherapy approaches. Medications like azacitidine or decitabine or Inqovi are some of the names you may see out there for those types of treatments. For other patients whose disease is behaving more like an MPN disorder, more on that end of the spectrum with maybe higher blood cell counts, a larger spleen, which can be uncomfortable in the abdomen and make people feel full more quickly and lose weight, things like that. When those are more of the issue, then we have medications called JAK inhibitors. JAK inhibitors can take that thermostat that's stuck in the on position in these cells and basically turn it down a notch. And that can really help improve people's spleen sizes and some of the symptoms related to the disorder. So we really personalize that approach depending on where on that spectrum the individual patient's disease falls.
And what's on the horizon for MPN treatment? Anything coming up that's in development or that's looking promising?
There are a lot of things coming up that are in development in MPN therapy. So we've had for a number of years now, we've had a couple of JAK inhibitors that have been on the market. One is called ruxolitinib or Jakafi, and the other is called fedratinib or Inrebic. Both of those have been on the market for a while and have proven benefits in being able to shrink patients' spleens, improve some of the symptoms related to the disease, help people feel better overall. But the major downside of those treatments has been that they lower the blood counts. And for some patients, that can be a good thing when the blood counts are too high. But for many who are struggling with low blood counts to start out with, those treatments are very limited as far as how much of the dose we can get in, and if we can even safely use those treatments at all for people with lower blood counts. So now one of the biggest advances in our field over the last year or so has been the approval in the US of two new JAK inhibitors. one that's called pacritinib that was approved in February 2022, and another that's called momelotinib that was approved just in September 2023. So pretty hot off the presses. Both of those JAK inhibitors can be used in patients with lower blood counts. So pacritinib is safe to use in people have very low platelets, less than 50. And momelotinib can be used when people have anemia. Pacritinib potentially when people have anemia as well. So now we essentially have a JAK inhibitor for basically all patients with an MPN, which is great, or with myelofibrosis. But still, with these JAK inhibitors, we're still really just scratching the surface of the disease. We're helping people feel better, helping them live better, we're helping them their spleen shrink. But unfortunately, we're not doing a great job at preventing the disease from progressing over long periods of time still. So one of the biggest things that was presented at the American Society of Hematology meeting this year were two large randomized clinical trials comparing a JAK inhibitor alone, ruxolitinib alone, versus ruxolitinib plus a newer medication. One of those newer medications is something called pelabresib, and the other is something called navitoclax. So both of these large phase 3 trials showed really remarkable benefits of the combination approach in patients with myelofibrosis. So those trials showed that we were able to take response rates, response being the number of patients who have their spleen size shrink a lot, shrink by 35% or more. We were able to improve the number of patients that have that response from about a third of patients with ruxolitinib alone up to about 2/3 of patients who are treated with this combination, which is a really big step forward for our field, and I think is going to be a new way that we approach treatment for people with myelofibrosis.
And finally, should you mention clinical trials, of course, in the development of these new options that may be available soon. Can you explain why it's important for patients to consider and to ask about and consider clinical trials?
I think right now more than ever, it's important to ask your physician about clinical trials and whether there's a clinical trial that might be appropriate for your situation. The field of MPNs and the field of MDS and the field of these MDS MPN overlap syndromes, all these fields are really evolving very rapidly. We've really just started to uncover a lot of the biologic mechanisms that are driving these diseases and causing these diseases to happen and progress. And now that we're starting to get a better understanding of those things, now we're really able to start developing some treatments that might make a big difference for individuals. So a lot of those treatments are currently available in clinical trials, and the only way to get access to them is to participate in a clinical trial. By doing that, you may be able to get, as I mentioned, access to an earlier, potentially the latest, greatest treatment that may make a big difference in terms of improving the disease for you, and may also make a big step forward for our understanding of the disease for people in the future as well.